Hi, welcome to our Facebook Live event with Shelley Mannell. I'm Heather Schmidt with Integrative Education. I'm excited that you're joining us today. We're really looking forward to our conversation with Shelley about her upcoming course, Dynamic Relationships, a Contemporary Approach to Postural Control, that's going to be at our 2021 Integrative Education Symposium, which is just a few weeks away. We have registration that is ending this Saturday, February 20th. So if you're already signed up, we can't wait to see you. If you still haven't signed up, I hope that this discussion with Shelley will help you to consider her course or go to our website and check out some of the other offerings as well. So I'd like to bring on my guest today, Shelley Mannell. Thank you so much for joining me this afternoon. How are you?
I'm fine, thank you. And thank you for inviting me. It's a pleasure to be here.
Yes, it's always lovely to talk to you. I appreciate your time and having this conversation, helping people to learn a little bit more about postural control and a little bit more about the course and what to expect. If you're joining us, feel free to put in the comments any questions that you have for Shelley. We certainly have time to make sure those questions get answered, whether it's specifically about the course or just about postural control in general. We have the expert here, so feel free to chime in with any questions. So my first question that I have for you, Shelley, as I'm thinking about postural control, I know, and we have a lot of folks in our audience and that attend our webinars and our symposia, there's a lot of overlap with OTs and PTs with supporting postural control. And so I'd be curious to hear more from your perspective, why it's so important for both of these professions to really understand and treat this underlying area of dysfunction when thinking about treating pediatrics.
Well, that's great. Great question, Heather. Postural control really is the foundation for all of our motor skills. So controlling our body in space is essential for all of the quantity and the quality of our functional motor skills. And that doesn't matter whether or not it's gross motor or fine motor or oral motor. It's also important for speech language pathologists. Many of the motor speech approaches that I can think of, the two that pop into my head immediately are the prompt system and also talk tools. Both of them talk about the importance of requiring what they more generally term trunk stability as a preparation for the success of those approaches. But when we talk about trunk stability or when we talk about balance, I'm not sure that we really have a good grasp on what we're really meaning when we use those terms. So when we use the term postural control as a therapist, when I'm assessing a child, I do need to know what is contributing to why that child cannot do the skill. And it doesn't matter whether or not the skill is walking or jumping or being able to dress themselves or, our job is always to find out and to peel back those layers to figure out why that child isn't able to accomplish that skill. And a lot of times postural control contributes to that. So again, underlying all of those functional motor skills. So we all need to be able to treat and appreciate at least the basics about postural control so we know how it's contributing to that child's challenge.
I muted myself so that you wouldn't get any feedback and then forgot to unmute myself. Thanks so much for that, Shelley. I appreciate all of your sentiments on that topic. Curious, I'm gonna throw a question before we go to kind of our usual set of questions that we talked about. When you were saying, that it's one of our jobs to kind of peel back the layers and kind of understand that postural control piece. Is there, if you were to estimate or think about your caseload or the types of children that we often treat, what percentage or amount of kids are you seeing that postural control is an underlying foundational, or is that a really hard question to
No.
answer? It just kind of popped into my
100% of my children have postural control. When you look at a number of things, right? When you look at the components that are involved in postural control, there is fallout for 100% of my clients. Even children who, when I see them, even if I'm not going to be, I think perhaps the primary treating professional, sometimes I work in a clinic with a group of very talented OTs. And so sometimes someone will come in through my referrals and I will look at them and say, you know what, I see the issues that are here, and I hear the challenges from mom and from the child. And so sometimes I may not be the primary treating professional or the most appropriate treating professional for that child. But it's up to me to know why that is. So children who have, trying to think of someone, for instance, who has a significant motor planning or apraxia problem, I may not be the most appropriate person to follow that kid over time. We have a couple of OTs who are very much more talented in terms of motor planning challenges than I am, but almost all of those children also have an underlying layer of postural control challenge. So then we sort of get together as a team with the family and decide how it is that we're going to navigate this. And again, I think that a lot of our children, when we broaden our lens to look at all the pieces that contribute to postural control, that we find that more often than not, children have a postural control challenge. So I don't have anybody on my caseload who doesn't. Even my wee torticollis baby are experiencing a postural control challenge.
Yeah, that was going to be my guess. When I think of the children that we're serving, so my the primary way that I'm serving students or serving children is in schools. Mm-hmm. And when I think of those, most of our, a big referral source are kids with motor planning issues, handwriting, and also self-regulation. And, there's so many of, a high percentage, I don't know if it's 100%, but, so many of them have an underlying foundational postural control challenge, and how to think about that and weave that into and what impact it has on school function too. So just curious to.
Absolutely. And when we think about, you talk about children with regulation challenges, and one of the things that we always talk about when we talk in Dynamic Core for Kids about the anticipatory component of postural control, one of the major contributing factors to that is the contribution of the inner core muscle team, which of course is the respiratory diaphragm and the pelvic floor and the TA. But the diaphragm is such an important piece of regulation. So we often talk about the fact that you can't necessarily have regulation without alignment, but you can't necessarily have alignment without regulation. So there's that interconnection, and really you can't get away from it, can you? They are so intertwined.
Well, I think of so many of the students that I see, they're like, you tell them to take a breath and it's all their accessory muscles and there's just no diaphragm happening. And so, it's, there it is.
There it is. And there it is. And you're thinking, wow, that's really not helping us. And so it's kind of like, again, so then let's peel that back. So again, a lot of those issues that we come to when we talk about it they're alignment based. We understand that the brain will pick up and recruit a muscle if it's in that mid-range alignment. So rather than, teaching the kids to balloon out their belly or do something in terms of trying to decrease the chest breathing, we could also introduce an alignment with all sorts of different opportunities for that, and let the brain do the work and let the brain do the heavy lifting instead of us engaging cognition for that.
Mm-hmm. Absolutely.
Yeah.
Well, shifting gears slightly, but still along the same lines as far as just thinking about this particular course that you'll be presenting at the symposium is, kind of dubbed a contemporary approach to postural control, which I think people always appreciate the most up-to-date information and, evidence-based. And so I'm curious to hear more about how this compares to past approaches, or how it previously was talked about, and how, your information is kind of bringing things together and in a different way for people to kind of be mindful of postural control.
Sure. Well, again, I'm a clinician of a certain age. So in my training, we didn't really get a whole lot on postural control. It wasn't a major piece of my training as a physical therapist. So we talked a lot about motor skills, but we didn't really learn a whole lot about the intricacies of postural control. And so early on in my career, I actually did my 8-week pediatric NDT training. And so in that moment, NDT talked a lot about trunk stability, but it wasn't really defined a whole lot more than that. Mrs. Bobath was a consummate clinician, and she was also a sculptor. So her hands were wonderful. And she was incredibly attentive to alignment. But the generalities that we talked about alignment were just that. They were more general pieces of information rather than absolute specifics. We talked about, how difficult a posterior pelvic tilt was, and thoracic flexion, or those sorts of things, and we talked about probably actually not on that course, but later on when I took some lovely courses from Rona Alexander, who is an NDTA speech language pathologist instructor. Rona talked about the children breath holding for stability and using their diaphragm for stability. So we learned to pay attention to that. There wasn't an expanded conversation about what was meant by trunk stability, and exactly what alignment, other than, we didn't want the kids in a posterior tilt at the pelvis, what exactly were we looking for in terms of what we were trying to create with our hands, and what input we were giving the children for that. And of course, there was also no conversation, and there is some now, but again, it's not a fulsome conversation about the sensory inputs and how they contribute to postural control. So we talked, a little bit about trunk stability and a little bit about alignment, and we talked about balance reactions in terms of postural reactions, head righting and trunk righting and equilibrium reactions. But again, not in an expanded conversation. And we learned all the reflexes, but we didn't sort of learn where they fit in to that whole conversation. So I had to know what they were and what the typical was, and I had to know all about that, and then we never talked about them again. So again, NDT looked at some specifics, but not a lot, and they left out the discussion about the sensory systems. And then if we look at sensory integration, we can look at the fact that obviously they have a wonderful conversation about all of the sensory systems and how those contribute. And we have conversations about, again, head righting and trunk righting reactions, and we look at equilibrium reactions. But again, there isn't an expanded conversation about alignment and how alignment impacts recruitment and the impact of postural control or different aspects of the musculoskeletal system. So we don't talk about muscle physiology or muscle fiber type and those sorts of pieces that can impact motor output. And so the concept of, it's like, oh, well, we just need a stable trunk is a little superficial. We need, and now we have so much more information. I mean, so many people and schools of thought have contributed to what we understand about postural control and how it can work, that we've realized, or we should be realizing, that it really is quite a concept and it's complex. There are lots and lots and lots of different things that we should be considering, and they don't all apply to every child, absolutely not. But we should be looking at them with every single child so that we know which issues are most important for this child, you know, and in that way we get a handle on what we might need to look at when we start to treat that child.
I know in your course you're going to be doing 12 components, not 10 like I had emailed. But I mean, you've mentioned some of them here. There's a lot there. It isn't just trunk stability. It is the sensory systems. It's these other components that all fit together. And I know that's a big part of your courses. You're going to be looking at these different components and helping folks understand from a treatment standpoint and an intervention standpoint. So I'm wondering if you can talk a little bit more about some of these components and how they work together, which is a big question.
Well, that's the essence of the day, isn't it? Sure. So obviously, I mean, I've explained this before. Obviously, this is a one-day course. So we don't have time to go into detail about each of the components. So we will the day serves as a primer rather than that deep dive. I think when we last chatted, we talked about the fact that the deep dive happens in my Foundation for Function course. And that's a multiple 2-hour sessions that explore each of those components in a lot more detail and has pre-readings and assignments and all of those pieces so that we really gain some mastery. But the point of that, and the point of condensing some of the most important pieces, there are lots of pieces that I didn't have time to include, but the point of that was to work to create a clinical model that was relevant in terms of postural control, so that therapists could understand what was happening with that child, and how postural control was creating the foundation for functional movement, and begin to understand how to peel back those layers and figure out where the challenge was or where the challenges are, and try to figure out what they could be addressing in terms of treatment. So we talk about muscle tone, and we talk about emotional regulation, and we talk about anticipatory mechanisms as well as reactive mechanisms. And so we talk about vestibular and visual and proprioceptive and tactile, the sensory systems. And we also talk about internal representations. And finally, we talk about cognitive resources. So if, for instance, if one of those sensory systems is challenged, then we know that a child may use or overuse other systems to compensate, but that's not necessarily creating efficient postural control. So it's working backwards from what that child is having difficulty with, and then understanding where those challenges lie, and then figuring out how that's impacting their postural control as their foundation for motor skills. So in my career, I've known lots of children who really realistically should have been up on their feet walking, but they had no interest and no motivation for doing so. But I've also known kids who had no, earthly right in any sort of a, when you read how their challenges, you can't believe that they can be up on their feet, but that kid was determined. So they were going to put all of their resources together and make it happen. So the contributions of all of those pieces in terms of creating postural control, and they all work together. That really is the point of the contemporary model, is that these things don't happen in isolation. You don't have a child who has a vestibular deficit who has no trouble with postural control. And we've seen that from our research. We have studied children who have no motor challenges, but they have, for instance, a hearing deficit and need cochlear implants. And so those children have vestibular deficits, and they have balance deficits that are related to the vestibular system, not just related to the auditory system. And so that bears out with all of the children that we have studied in the literature, children with anxiety who have no history and no comorbidity of motor challenges or sensory challenges, that they have anxiety and as a primary mental health diagnosis, but their postural control is poorer than a child who is typical, because the systems all work together. They are all connected. So we very, very rarely have one without the other. Even my kids, who I think are not going to be, I think they're going to be straightforward. They come in with what is supposed to be just a simple musculoskeletal blah, blah, blah. And all of a sudden it's kind of like, yeah.
When you start to look at all those different pieces.
Yeah, it's kind of like, no, not quite as simple as we first thought, which of course is why they're struggling.
Right. Yeah, I think so. What I'm hearing you say, and I just want to see if I'm thinking about it in the right way. There's not necessarily, is there a hierarchy, or is it kind of they all just are working together? From what I'm hearing you say, it sounds like there is not necessarily a hierarchy, but they might pull different resources at different times depending on their motivation or what there are deficits in. But I'd love to just.
That's perfect. Yeah. And that's the essence, isn't it? That we used to think that this was all hierarchical, that you did this and then we did this and then we did this and then we did this. And really what we've moved now to from thinking about that hierarchy is we've moved into that dynamic systems model. That each of those components is important. And it really depends on, as you say, how things all go together. It depends on the task. It depends on the environment and all the things that we know about our kids can do it here, but not here, right? It's like my kid's piano teacher used to say, you can practice the piano in the quiet while you're learning the piece. But eventually you have to be able to do it when the door is opening and mom is yelling and your sister's poking you in the back. And so it becomes a very different task with very different requirements when you're doing it in that environment versus when you're doing it in the total quiet and nobody's bugging you. So each one of them has their own requirements. So that's what I loved about dynamic systems theory, is that made so much sense to me. Made it a whole lot more complicated, I got to say. Wasn't as easy as thinking, well, first I could do this and then I could do this and then I could do this. I'm, left-brained PT. I like to be linear about things. But it was so much more interesting to think about it as a dynamic systems theory. Shumway Cook and Woolcott actually were the two researchers and authors who began my journey on postural control and dynamic systems. But now that we have such an expanded knowledge base about the sensory systems and so much new information about the anticipatory mechanisms, the original model that they had is fairly limited. So one of my goals was to come up with a new model that creates that look at more components and understanding the dynamics between those components in a much more expanded way, so that we can appreciate what's contributing and how they're interacting. And one of the things that I think it can also help is when we use the model, not just for assessment and treatment, but when we understand all the pieces, therapists can also use it as a way to help them identify where they might want to go with some of their continuing education to get more skills. So if I have, all of the kids who are sort of significantly low tone, and I want to learn more about that because I want to learn more about muscle tone, or I want to learn more about the treatment of kids with low tone, then I might sort of follow off on that tangent. But if I have a lot of kids who are post-operative and have a lot of scars that I think are impacting their movement and their freedom of movement, then I might want to go in a different direction for my continuing education. So it's an ability to look at that model and say, okay, all right, well, I'm pretty good. I'm comfortable with my skills here and here, and I'm doing really well. But this seems to be an area of challenge when I see these kids. So maybe I need to seek out a little bit more information about that. And that's part of the thing that I think is so fun about pediatrics, is there are so many areas and so many children to see, and the possibilities for learning are endless.
Absolutely. I mean, I think that's what keeps us as therapists coming back, is that, they're such intricate, there's so many different pieces at play that contribute to function. And, thinking about all of those pieces, Michelle Mannell made a comment just about dynamic systems theory and how she's, loving how, this course is going to be coming together with thinking about all of those different components and pieces. And I really appreciated what you said, Shelley, about, this is a one day. It's going to be jam-packed. Shelley has an amazing lineup for you, but it also is a way to start to see, okay, these are all the components, and where do I have competence, and kind of framing it that way, and this being a piece to further learning and understanding as well. But yeah, I think this course is going to be a wonderful offering for those of you that are signed up. You're going to be in for a treat with hanging out with Shelley for the day. And for those of you that haven't signed up yet, consider joining us on February 27th. It's a Saturday. There will also be a recording of the course if you can't join us live or can only join us for a portion of the day. Within the week of the event, you'll get a recording, and there'll be a post-course quiz that you can take to get your CEUs. It is a full 6 hours of contact hours, and we are AOTA approved, so we hope that you will join us. If you want to go to our website for more information, Shelley's bio is there, the agenda, all of the specifics as far as the components and information are all listed on our website. So we hope that you join us then. Anything else you want to close with, Shelley?
I don't think so. I look forward to seeing everyone and having a great day.
Me too. I am super excited. I think it's going to be a great event, and we hope that you join us. Shelley, if you want to hang on just for a minute, we'll end the broadcast. And thank you so much, everybody, for joining us, and we hope to see you soon.